In Old Money, a second-season episode of The Simpsons, Abe Simpson inherits $106,000, which is about $225,000 today. In the episode, Abe wishes to give the inheritance away to a worthy cause, which is how he comes to listen to a pitch from the town psychologist, Dr. Marvin Monroe.
It's a special isolation chamber. The subject pulls levers to receive food and warmth. The floor can become electrified, and showers of icy water randomly fall on the subject. I call it the Monroe box.
Well, it sounds interesting. How much will it cost to build?
Oh, that's the beauty part. It's already built. I need the money to buy a baby to raise in the box until the age of 30.
What are you trying to prove?
Well, my theory is that the subject will be socially maladjusted and will harbor a deep resentment towards me.
Interesting.
The joke here is that Dr. Monroe is trying to prove something that is obvious. Of course, if you abuse a human being in this way, it's not going to end well. How could it? This got me thinking about how nearly all public health officials behaved during the COVID panic and the measures they enacted. Looking back, did any of them have the wisdom of a Simpsons cartoon character? Who showed more wisdom, Dr. Marvin Monroe or Anthony Fauci? If you hated the era of the COVID regime as much as I do and want to ensure that it never returns, get my free ebook, The Little Book of COVID, Red Pills, at redpillcovid.com. It is the baby version of a larger book I am writing and contains the top 5 arguments you can use against supporters of the COVID regime. The era of the COVID panic was a dark, Orwellian time that must never be repeated. We all have a part to play. Learn how to expose it to the light by getting the little book of Red Pills for free at redpillcovid.com today. And now, back to the video. Prior to the COVID panic, all of the non-pharmaceutical interventions that public health would soon import from China, from lockdowns to social distancing to masking, were not part of any Western nation's pandemic plan. They all echoed the wisdom of public health giant D.A. Henderson when he stated, "Experience has shown that communities faced with epidemics or other adverse events respond best and with the least anxiety when the normal social functioning of the community is least disrupted." In 2006, writing in the paper Disease Measures in the Control of Pandemic Influenza, Henderson also said this, "There are no historical observations or scientific studies that support the confinement by quarantine of groups of possibly infected people for extended periods in order to slow the spread of influenza." A WHO writing group, after reviewing the literature and considering contemporary international experience, concluded that forced isolation and quarantine are ineffective and impractical. In 2019, both the World Health Organization and Johns Hopkins recommended against lockdowns and masking in separate reports. When China began to employ its Fangkong policies in Hubei province by forcibly locking down its 57 million residents, Anthony Fauci himself expressed skepticism. Historically, when you shut things down, it doesn't have a major effect. A WHO representative, commenting on the Chinese lockdown, noted, "Trying to contain a city of 11 million people is new to science. The lockdown of 11 million people is unprecedented in public health history. The science was clear." Prior to January 23, 2020, every Western scientist and public health official echoed the wisdom of D.A. Henderson. They all knew that you could no more contain or control a virus than you could prevent the ebb and flows of the tides. But for reasons I will not get into here due to time, but will be explaining in future videos, so don't forget to like and subscribe, Western nations threw out their well-established pandemic plans and adopted China's strategies. Following China's health policies was analogous to an office having a well-thought-out fire escape plan. Then, when they perceived there was a fire, the fire marshal decides to throw out the sensible plan for a cheap Chinese knockoff. What's more, the Chinese plan involves everyone setting their hair on fire and running around like idiots. By exchanging reason for madness, this is what public health did during the entire COVID panic. What were the results of exchanging Western science for the Orwellian policies of China? As real Western science predicted, lockdowns failed right out of the gate. As early as April 26, 2020, T.J. Rogers wrote an article in the Wall Street Journal titled "Do Lockdowns Save Many Lives?" In most places, the data says no. He found no correlations in rates of death between states that locked down and those that didn't. In fact, he found that states that didn't lock down or had less severe versions had a slightly lower death rate than those that went full China. The correlation was weak, but it was there. Regardless, lockdowns provided no benefit. As the data continued to roll in for that summer, the wisdom of D.A. Henderson continued to be vindicated. Lockdowns failed to reduce deaths in the U.S. Total deaths declined more from previous years in free states than in lockdown states in spring, reported the primary Doctor Medical Journal in June. In September, in an article entitled "The Failed Experiment of COVID Lockdowns," D.L. Luskin again found that lockdowns correlated with greater virus spread. Further, states that opened up, despite the warnings of health experts, experienced decreases in caseloads. What is going on here? I have a theory. In terms of disease, there are two actors in this dance. One is the virus, which frankly you can't avoid. Trying to do so is the equivalent of trying to stop the tide from coming in. The other dance partner, though, is your immune system. Could it be that by imposing lockdowns and doing the exact opposite of what D.A. Henderson recommended, public health did great harm? Could it be that imposing the maximum amount of disruption to people and their lives wasn't such a good idea? What do lockdowns and similar Chinese policies do to the health of the human animal? Off the top of my head, I would say less exercise, less fresh air, less sunlight, poor eating habits, overeating, increased alcohol consumption, increased drug use, increased stress due to financial issues, increased stress due to lack of social contact, increased stress due to losing everything you valued that made life worth living, increased stress from believing the people around you and the very air you breathe could kill you, stress from masking, including not being able to see people's smiles, poor health from missing cancer screenings and other medical issues, increased anxiety of the young who had to miss out on life's milestones, from graduating to sports to just hanging out with your friends. This is just a partial list. I'm sure you can think of more. Am I wrong to think that all of these factors would negatively affect people's immune systems? Could it be that this is the reason that no one can detect a virus spread? Could it be that this is why lockdowns, etc., led to an explosion of positive COVID tests, even discounting the ridiculous PCR tests that were being used? In closing, and to further bolster my thesis, let's consider this example from the UK. On July 19th, 2021, UK Prime Minister Boris Johnson declared that all COVID restrictions would end. He called this day Freedom Day. In response, 1,200 experts declared that this move was dangerous and premature. The Scientific Advisory Group for Emergencies, the experts which advised the government, claimed that ending restrictions would result in COVID cases spiking to over 100,000 a day. Professor Neil Ferguson claimed that the real question was whether cases would reach 200,000 a day. Despite these relentless attacks from the experts, Boris Johnson finally stuck to his guns. The results? Within 2 weeks, cases fell to 21,500, a 5-week low. Chalk up another loss for the Fang Kong policies of China and the Western experts who followed them. In closing, let's again consider our question. Who is smarter, Dr. Marvin Monroe or Anthony Fauci and the COVID regime? Dr. Monroe, for all his faults, at least knew what the results of his ludicrous experiment would be. The COVID regime, on the other hand, literally put their entire populations into their own version of the Monroe box. Incredibly, these single-variable Karens not only failed in their stated objectives, but they literally burned their societies down in the attempt. To this day, they have not admitted their failure. The results are clear: lockdowns were a disaster, and Dr. Marvin Monroe knew more than Anthony Fauci. Those are my thoughts. What are yours? Did I miss anything in my list of negative health outcomes experienced from people due to lockdowns and the response of the COVID regime? In the future, I plan to explore some of the questions I raised in this video. These include: why did the Western public health follow China's example? Virus spread and the nature of the flu. Why the PCR tests were frauds whose only purpose was to stoke fear. Are there any questions you would like me to explore in future videos? If so, leave them in the comments, and I'll see you next time.